Understanding Intervertebral Differential Dynamics (IDD) Therapy. Surgical intervention for back pain is common. The best medical doctors suggest surgery only after you've exhausted all non-surgical options. Most will recommend exercise-based physical therapy first, followed by epidural injections. Often, prescription drugs, though dangerous, are also prescribed, but there is another option. Research studies show that degenerated and herniated discs respond to treatments that properly and safely manipulate the spine. IDD therapy on the AccuSpina system was developed by neurosurgeons who recognized how even serious back pain can often be resolved without surgery. IDD therapy is an advanced form of spinal decompression treatment that allows the body to heal many back and neck problems without injections or invasive surgery. In a typical IDD therapy treatment session, the AccuSpina machine applies targeted decompressive forces at a precise and mathematically calibrated angle based on your body type and diagnosis to create rehabilitative spinal mobilization. The pressure rate gently fluctuates in sinusoidal wave pattern, like a pumping movement between the vertebrae, gently repositioning the dysfunctional spine segment by lowering interdiscal pressure significantly below 0 millimeters of mercury. These negative pressures inside the disc can work like a vacuum to help pull the leaking material back towards the center of the disc. As dynamic energy at the treatment site increases, so does the space around the injured disc. Surrounding muscle elongation begins. Sensitivity of neurofibers are lessened. Segment-specific IDD therapy treatment on the AccuSpina works to relieve pressure off the injured disc and free up the affected nerve root non-surgically. During the height of an IDD therapy treatment, a second waveform is introduced to the spine, oscillation. Unique to IDD therapy treatment, the AccuSpina system is capable of producing oscillatory signaling. These micro-vibrations seek to alter the neural communication pathway, or proprioceptor signaling, to enhance natural tissue regeneration at a cellular level and further improve nutrient diffusion, essential to disc repair. Treatment sessions are so comfortable, many patients fall asleep. Research studies funded by the National Institute of Health conducted at Mayo Clinics, as well as others performed by medical doctors associated with Emory, Harvard, and other leading health institutions confirm dramatic reduction in pain and disability can be achieved non-surgically with IDD therapy treatment on the AccuSpina system. Pre- and post-MRIs also confirm how IDD therapy treatment can help a disc bulge shrink. Disc rehydration is also evidenced on MRI, showing measurably increased disc height and fluid retention after a full treatment course of IDD therapy. In one independent neurosurgical study conducted on over 500 patients referred to have surgery, 92% achieved relief with IDD therapy treatment instead of surgery, boasting the only 20-year excellence in safety record. The AccuSpina is the only spinal therapy and decompression system to win patent after patent for exceptional disc treatment capabilities. Only IDD therapy treatment has shown in multiple peer-reviewed studies to be not only highly effective, but also long-lasting, with most patients reporting they continue to experience improvements 1 full year after completing treatment. No other spinal decompression can claim this success because no other decompression has our patented oscillating logarithmic curve. Now, you can restore the performance of a younger, healthier spine without the high risk and expense of a surgery. Ask your doctor if you're a good candidate for IDD therapy treatment on the AccuSpina system, one of the most studied, safest spinal treatments for non-surgical disc pain relief. Visit IDDtherapy.com to find a provider near you.